thank you everybody for joining us today. What the topic of the conversation is today is newly diagnosed with Parkinson's. So I'm assuming that you have been recently diagnosed, or you are the loved one or a family member of somebody that you know with Parkinson's. So what I wanted to go through today was a little bit about what I see in the patients that we work with who have been recently diagnosed with Parkinson's, and in doing so talk about 7 main tips to help you navigate the first steps of having Parkinson's disease. So there's been a lot that's changed in the research recently, and so the main things that I think have evolved and changed for the better are that we are helping people with Parkinson's a lot earlier. So as a physiotherapist, I used to only see people once they were experiencing quite a lot of difficulties, excuse me, at home with walking or with falls or just general difficulties with activities of daily living. Now we know that if we can help you from the very earliest stages, so as soon as you're diagnosed, we can really help to change the trajectory of the condition and also slow the symptom progression down and hopefully improve that symptom progression as well. So I'm going to talk about early intervention. I want to talk about the type of exercise that you need to do. And it can be a little overwhelming. If you're not used to exercise, you haven't done a lot in the past, it's going to be a little bit more challenging for you to get your head around the thoughts of having to do exercise on a regular basis. And so what I want to do is give you some tips and something that's really helpful to get you started and to try and make sure it's not as overwhelming as it otherwise could be. Now, if you're already exercising regularly, fantastic. What we need to do then is change the type of exercise that you're doing so that you get the biggest bang for your buck. And we call that neuroactive exercise. We talk about long-term change. So because Parkinson's, it is a degenerative condition, we can't change that, but we can certainly help or hope to change the acceleration of that symptom progression and slow it down. And so in doing so, we want to help give you some habits and some ideas on how you keep exercise and all the other really positive things around Parkinson's in your daily life. And so there may need to be some behavior changes that you need to make. And so how we talk about how we make that as easy as possible and as easy for you to stick to it. And then mindset. And I know this can be a woolly area for some people, but mindset is absolutely crucial. And so I'm going to go into a little bit about how your perspective can really help the way that you manage your condition. So PD Warrior is very much based on 4 pillars, and that's really what makes it as successful as it is. So it's not just around the exercise, although it is an exercise-based approach. It's very much around lifelong behavior change, which we've talked about, and giving you the toolkit to help you make those changes throughout your life. It's very much about empowering you. So, you know, not that long ago, it wasn't uncommon to go to a neurologist, be diagnosed with Parkinson's, be handed your medications, and, you know, we'll see you in 6 or 7 years for deep brain stimulation. Now, we know so much more about Parkinson's now, and it's very much about giving you the toolkit to help you become the driver of your journey, not just a bystander, not just a passenger. So it's helping you to understand how to empower yourself. And part of that is really learning and having as much knowledge as you can cope with. If you're in the really early stages, that might be too overwhelming for you at the moment, but as and when you're ready to understand more around the pathology of Parkinson's, then we want to be able to really hold your hand and give you well-informed and curated information so that you can be informed to make the right decisions. And then the 4th pillar is very much about support networks. And some of you may not have told your family members or your friends or colleagues at work. And it's about finding a time for you when that is right. And when it is right for you, it's really important that you build up that network and have a really strong social support network around you, because these are the people that are going to support you on the days when you might not be having the best of days, but also to celebrate on the days that you do have wins. And you are going to have days where you have lots of wins. And so you need a cheerleading squad around you for those days in particular. So what I've seen over my career is definitely a distinct change in the last 5 to 10 years around how Parkinson's is managed. So when I was at undergraduate physiotherapy school, we learned that you couldn't walk and talk at the same time. Exercise may or may not be that useful, but I really felt fairly impotent and fairly redundant in what I could do to help people with Parkinson's. That has really changed in the last 5, 10 years to something that is very, very powerful. And so, you know, we work on a model now where it's called neuroplasticity. And so that's around understanding how exercise is absolutely crucial and vital for you slowing your symptom progression down. And neuroplasticity in itself is using your brain's natural ability to rewire itself to become more efficient and to kind of bypass and override the areas that are not working so well in your brain. That's why it's such a successful approach. And there is definitely compelling and emerging evidence as well looking at neuroprotection. And so that's where we may be able to protect the remaining viable dopamine producing cells in your brain. And if we can do that, then that will obviously also slow the progression of your symptoms down. And so you can see here in this diagram, the 1950s where the very first rudimentary skills were taught in terms of visual cues. Drugs were considered very useful once levodopa was implemented, but exercise not so much. Deep brain stimulation has been a hallmark, but again, only for about 10 to 15% of the population. And now this is what we're looking at, I think, is the third revolution in how we manage Parkinson's and how you live well with Parkinson's and positively with Parkinson's. And it very much depends on the right kind of approach in your exercise, which is a neuroactive approach. So in terms of the 7 tips, these are 7 tips that I think are the most vital for you to live your best life with Parkinson's. So we're going to go through each of them in detail. If you do have any questions, please don't hesitate to pop them in the chat box. And I'm going to come to questions at the end of this presentation if I haven't answered them already. So the first one is, I guess, having an acceptance that, yes, you've got a condition and it is a degenerative condition, but you know what? You can live well with Parkinson's, but how well you live with it really is up to you, and how, I guess, not necessarily aggressive, but how assertive you are and how you deal with your Parkinson's. And the first thing is what I want to go through is about that mindset and acceptance of it. So you don't have to exercise, you get to exercise. And I think this is crucial because a lot of people with neurological conditions or heart problems or hip problems, they don't get the chance to exercise. You do. There's very little, if you don't have other outstanding comorbidities, from stopping you from exercising. So maybe in your mind, flip it now, if you're not used to doing that much exercise, from you don't have to exercise to the fact that you get to exercise, and you're lucky because you get to do that. I see a lot of people in the clinic who have Parkinson's symptoms, but they don't actually have Parkinson's, and those conditions are actually terminal. If you've got idiopathic Parkinson's disease, it means that you will live well with Parkinson's and you get to exercise. So along that same line, I think as well is understanding that you get to take medication. If you live in Australia, we are extremely lucky here in Australia. There are many countries in the world where levodopa medication, a lot of those Parkinson's preparations, they're not readily available. People are skipping days, skipping weeks, alternating their medication dosage because it's just not readily available. So in Australia, try and flip it from the fact that you have to take medication to manage the condition to you get to take medication. And because you can, that enables you to exercise well, and that in turn enables you to live positively with Parkinson's disease. And you get to live with Parkinson's. As I said before, levodopa really revolutionized how we live with Parkinson's. It used to be a very difficult condition to manage and people would die because of Parkinson's. That doesn't happen in this day and age. You live with Parkinson's. It's not a terminal condition, but how well you live with the condition is really dependent on you and how well you sit in the driver's seat and take advantage of all of the evidence and the literature that we have available to you. So a lot of that I'll discuss in the 7 tips. So just have a think now of all the things that really upset you or distress you about having Parkinson's. And I would challenge you to think about flipping that and think about, well, yes, it sucks, but what's good about that? Or what is a blessing? And what is something that you could be grateful for? Because I think having that initial appreciation and acceptance is going to really help you in the way that you manage your Parkinson's journey. The second thing I cannot underscore enough is building your team. And as I said before, if you haven't told family, friends, and work colleagues yet, when the time is right, I would strongly encourage you to start building up that support network. It is absolutely crucial. First and foremost, you need a really strong and dedicated health professional network. So that will be your physiotherapy team. It might be an exercise physiology team, occupational therapists who might be able to help you with any cognitive changes and really improve the way that you manage your day. Might be speech pathologists if there's difficulties with swallowing or speech, phonetics and being able to speak loudly enough. Obviously your neurologist and Parkinson's nurse, they all make up a very, very important team. And the earlier you build that team and that network, the quicker we can identify any issues that emerge address them really rapidly so that it don't become really problematic. If you've got a friends or family network, or you can start building that, or even if you don't, there are a lot of support groups available online. If a virtual arrangement, you can do that, and you've got the ability to do that. And obviously we in PD Warrior have Tribe 365, and that has really helped to connect people, not only globally, but even within Australia. And certainly in COVID times, it's certainly been very beneficial to have support networks available virtually as well. So surround yourself with people who are only going to lift you up higher, would be a very strong tip. The third one is to get your baseline measures. If you don't have any baseline measures, it's very hard for you to know on a daily basis how you're tracking, whether you're improving or whether you're deteriorating, even whether you're staying along the same lines. And so I would strongly encourage you to reach out to a physiotherapist that really understands Parkinson's disease, an occupational therapy team that really understand cognition, maybe a neuropsychiatrist or your GP if you're having any difficulties with mood. I've already talked about the community and how important that might be. And there are lots of different ways of measuring your mindset as well. And I think, you know, understanding where you're at just helps you then to build your treatment plan and look at where you're going. If you don't have that roadmap, it can be really hard to identify when you get there or when you're off course. So a lot of the things that we do in PD Warrior when we're looking at baseline measures are looking at your fitness levels, your strength levels, your agility and your balance, your confidence levels, and how you perform more than one thing at the same time. There's lots of different ways that we can measure all of these things, and combined, that gives us a really good picture about what we need to work on with you. So reach out to your local physio if you know that they understand Parkinson's. If not, please do reach out to the physiotherapy or the PD Warrior team to get those baseline measures. And then I would generally recommend that you get your measures done at least every 12 months, probably every 6 months, not unlike going to the dentist every 6 months just to get your teeth checked, make sure there's no issues there. I would say the same thing about your physical and mental health, is to have that 6-month routine checkup just to get your baseline measures done, address any issues that might be emerging. Even if they're small, best to nip them in the bud first. Types of Parkinson's, understanding this is really important as well, and this would be something that we would go through in your initial assessment. Understanding your type of Parkinson's really helps you to shape your exercise prescription, your program and your treatment plan. So we've simplified it into 3 different categories, and you might identify immediately with one of these. If you don't, it may be that you kind of cross 2 of them. So bradykinesia is if you identify as being really slow and shuffly, and that's the symptom that bothers you the most on a daily basis. So that might be difficulty with fine motion your teeth, doing buttons, doing zips or shoelaces, etc. If you find that you've got a really shuffly small gait, they may all be characteristics of bradykinesia, and we would treat that in a very specific way with your exercise approach. If you're tremor dominant, it would be the tremor that bothers you the most on a daily basis. So again, this is quite a different presentation to bradykinesia, and we would address that differently. So it would be very forced use activity with very high effort, so around the 80% mark. And that's not getting your heart rate up. We're not talking about cardiovascular fitness, although that's very helpful as well. We would be talking about increasing your motor output, and that would help you in your daily activities of dressing, walking, any of the activities that require motor output and effort in your movements, opening a door, turning the pages of the newspaper, for instance. And the third category is agility impaired, and this is somebody that would identify if you are freezing regularly, so more than 1 time a day, if you were falling frequently, so again more than once a day or once a week even, if you felt very uncomfortable or you lacked confidence if you're out in a shopping centre, for instance, negotiating other people, obstacles, furniture, all those sorts of things. And again, your treatment approach here would be quite different as well. So if you don't know what type of Parkinson's you have, on the homepage of the PD Warrior website, there is actually a link to a quiz, and that will tell you what type of Parkinson's you have, and it will then send you a report with some ideas and some ways to get started with different exercises. So please go and do that if you haven't done that already. The 4th tip is exercising the right way. So you need to know your type of Parkinson's first, and then we need to bring in this neuroplastic training approach. So I talked about before being neuroactive. So we use Neuroactive to kind of differentiate between neurodegenerative, which is basically sitting on your backside, being very sedentary and doing not very much at all. And we know both from animal and human studies that if you do that, that is going to accelerate your symptom progression rapidly. Alternatively, if you're neuroactive and you're adopting a neuroplastic training approach, which is novel, it's challenging, it's hard work, all of these things combined are really going to help you to rewire your brain and really improve the way that you move, the way that you think, and the way that you feel. And that's why we call that Neuroactive. Now, sitting in the middle of both of those is neurodegenerative and neuroactive is neuropassive. And that's what a lot of people are doing if you're exercising regularly already. And that would describe going for a walk around the block, taking the dog for a walk, even running marathons if you've been running them for a while and you're quite fit and active. Anything that you do routinely would be considered neuropassive because it's not challenging, it's not novel, it's not complex enough for you to be actually rewiring your brain in that, neuroactive approach. So exercising the right way is absolutely vital. And there's lots of different ways that we can teach you to do that based on the type of Parkinson's that you have. So this was just more of a description. And I think using an analogy like really rich, dense foliage on a tree would be if you're really neuroactive. There's lots of connections, and we can actually create a lot more connections depending on the complexity and the stimulation that you give your brain. The flip side of that is that your brain is also very good at pruning off redundant pathways. So if you're not stimulating your brain, you're not exercising it, you're not encouraging it to create new connections within itself, it's very efficient at pruning itself back. And that's like a deciduous tree in winter, for instance. You've got lots of branches, but not a lot of trees, a lot of dead bits, a lot of withering away. And that's essentially what's happening in your brain if you're not stimulating it regularly. So always when you think sitting on the couch and you don't want to exercise, think about what you're doing to your brain. Get up, get moving, and get out there. Be neuroactive in your approach to exercise. So some of the main pointers of being neuroactive in your exercise are being specific to your type of Parkinson's, specific to the goals and the difficulties that you might be experiencing every day. Making sure that it is effortful. Just sitting on an exercise bike at the gym reading the newspaper is not considered effortful activity. So it needs to really challenge you. And we use something called an RPE, which is a rate of perceived exertion. We want you working at 80% of your absolute maximum. So if you think about what it would take for you to absolutely work at your highest level, stepping that back a bit to 80%, and that's where we really want you working. So you don't have to do that for very long, but you do need to be working quite effortful. And the reason why we need you to see physiotherapists and exercise physiologists is to make sure that you do that safely. You don't injure yourself. And if you've got any other underlying medical conditions, that you do that in a well and safe way. Needs to be done on a daily basis. And again, this can freak some people out. It needn't. It just means that everybody needs to exercise every day. So do you. You just need to exercise in a specific way. And the whole way that we approach this in PD Warrior is to make sure that we give you the tools and the motivation and the ability to do that on a frequent basis without it becoming a huge chore. And we do that by one of the ways here being fun, and trying to tie your goals into something that's very relevant, very meaningful, and very salient to you. And so packaging that all up into something that really motivates you intrinsically to want to exercise on a daily basis. And the two here that we haven't talked about down the bottom are complexity. So enabling you to do more than one thing at the same time. So that might be getting coins out of your pocket whilst you're walking. It might be carrying the shopping whilst you're walking. It might be having a conversation with somebody whilst you're walking. Any number of things, both manual upper limb as well as cognitively thinking about stuff while you're doing another motor activity, are really important for living. And so we want to enable you to have the skill to do both, because that can be problematic in Parkinson's. And then the last one is power. And this is specifically for people that are bradykinesic, so slow and small in their movements. We talk about an approach that really tries to exaggerate your movements and encourage you to recalibrate what is normal, what should be normal movement for you, to make you much more functional and active in your daily life. So all of these things on this circle here are the 7 core principles that we bring into our neuroactive training approach. And so we teach you that so that whatever activity you're doing at the moment that might be considered neuropassive, we can bump nearly all of those into the neuroactive category by drawing on these key principles. So number 5 is be consistent. So again, it's about helping you to understand what motivates you, what is going to get you out of bed on the days when you really don't want to get out of bed. And there are going to be days, we all have those days, and you might have more than most, or you might be a keen bean and get out of bed and you just lose that traction for whatever reason. So the first thing is identifying the intention and having the intention you want to get out and do those activities, and then it's actually executing those. And so there's lots of different ways that we can work you through those strategies to really help you be consistent on a daily basis. So your brain really needs this constant fuel, you know, water, nutrition, sunlight, all of those things. So does your brain. On a very simplified level, we need to get that lush foliage happening in your brain, and that comes from activity dependent stimulation. So, you know, gone are the days from sitting on the couch feeling sorry for yourself. You need to get up, get moving, doing novel activities, both physical and mental. So this is just a lovely quote I wanted to pop in here. Motivation gets you started, but habit keeps you going. And so that's why in our PD Warrior program, we actually have a 10-week training program called the 10-week challenge, because it's not enough for you just to start with an exercise program. It's about building that into your daily life, building in the way that you move, that you do at different activities and exercises, so that they become habit for you. Every time you open the door, you're actually doing your rehab, because you're drawing on those key principles we've taught you. Every time you get dressed, you're actually doing rehab. Every time you go for a walk, you're doing it in a way that means you're doing your rehab as well. And so building those things in, they become habitual, and you do them on a regular and a daily basis, as well as your exercise as well. Number 6 is about educating yourself. And this is really, really important, because I think the more education, the better armed you are with information, the more you can make those informed decisions for yourself. And so here we talk about optimal medication. So it's up to you whether you choose to take medication. Some of you are not on medication, I'm sure. Some of you have just started. Some of you are kind of fluctuating between, oh, this is really not working for me, or it isn't. Please talk to your neurologist, because if you're not optimally medicated for Parkinson's, then we can't do the best we can with the exercise and training program. So if you're not moving at your best 80% of the day, you probably are either under medicated or you're not taking medication at this point in time. And that is really going to hamper your ability to exercise well. And we know from the literature, the more exercise of the right kind that you can do, the more likely we can slow your symptom progression down. So there's going to be lots of reasons you don't want to take medication. Please have that conversation with your neurologist, so that you can be as well informed as possible around what optimal medication means for you. Obviously around exercise as well, we've touched on neuroplasticity and having a neuroactive approach with your exercise. It's absolutely vital. And I would strongly encourage you to reach out to either a PD Warrior instructor, you can do that online or in a licensed facility, or somebody that really understands Parkinson's and exercise, to make sure that you get the best approach for you, and that it's modified specifically for you and any injuries you've had, or your presentation, your type of Parkinson's, anything to do with that, so that you can get, again, the biggest bang for your buck. Making sure you've got your community set up, you've got good nutrition, and we know that some of the food proteins, for instance, can impact and hinder the levodopa medication. So again, understanding when and how you take your medications and your food and what you take, and some of the macros can be really helpful as well, and really limit how much medication you need to take. And that's always a benefit when there's side effects, attached to the medication that you do take. And ultimately, this will all help to improve your quality of life and your daily function, and help to keep you on the same path, if not better, for as long as we possibly can. And that's the ultimate game. The ultimate game here is, playing the long game and bringing all of these skill sets into what you're dealing with. So the 7th tip and final one here is about living brave. And this can be really challenging when you're facing a degenerative condition. But, I've met so many people on this journey now who have actually said being diagnosed with Parkinson's was actually the best thing that ever happened to them. Now, I'm not expecting this for everybody, of course, and these may be more of the outliers than not, but it really helped me to reflect on what that meant for some people. And it really has helped them to refocus what is important for them, reprioritize, whether it be family or work or whatever it might be. It opened up a whole new avenue of friendship circles and job roles and all these different things. So, you know, if you're newly diagnosed, I can certainly understand that there's probably a sense of lack of control. You don't know what the prognosis is going to look like. You don't know what you're going to be looking like in 5 to 12 years. You don't know how to tell people. All these sorts of things, I'm sure, are swimming around in your brain. And it's very easy to catastrophize, but let me tell you, there's so much good that can come if you just open yourself up to living brave. And that can be picking goals that you'd probably shelved, picking activities and life goals, bucket list adventures, anything that is going to motivate you to live your best life possible. As I said before, you know, Parkinson's is not a terminal condition. You will live with Parkinson's. You will almost live as long as somebody who hasn't got Parkinson's if you keep up your exercise and don't allow yourself to have other comorbidities, other cardiac, metabolic conditions. These are the things that are really going to slow you down. Make sure you're well educated about yourself, about your Parkinson's, about your network, about the literature that's emerging, how you can live your best life possible. Make sure that you have a mindset, or you work on having that mindset where you are grateful for the things and the movement that you have today. Because trust me, working in neuro, I can understand there are always going to be people that move better than you, and there are always going to be people that move worse than you. I work with spinal cord injuries. I work with lots of different conditions, and believe me, they would love to have the movement and ability you have today. Even on your worst day, they would love to have that. So it's about, you know, feeling grateful for what you have and really trying to change your perspective to one that can to get the most out of the opportunities that you have on a daily basis. Now, I don't have Parkinson's, obviously, but I come from a really unique background where I've worked with thousands of people now who have got Parkinson's, and this is a really common thread that I hear through all of my communications. And if I can, again, underscore the importance of that support network. Build that up with your family, your friends, your health professionals, people that really understand living with Parkinson's, because it may not be your family and friends that do understand what living with Parkinson's is like. So make those connections with people that live with Parkinson's and are like-minded. If you are a real go-getter and want to exercise, then those are the people you need to connect with. If you're not, then they might be the people you need to connect with as well, who will inspire you and motivate you to get moving. So just a little bit about PD Warrior. We know it works. We've done research on it ourselves, and we know that 98% of people think it's worthwhile. And I think a large part of that is not just because it's a neuroactive approach. Exercising the way that we prescribe exercise, we know you're going to improve. If you do it the way it's designed, you are going to improve. Now, that's really exciting for me to say that, because 5-10 years ago, I wouldn't have been that confident saying that about Parkinson's at all. I know this because people then build connections, they have those support networks, they understand the pathology of Parkinson's and how to manage it better. And all of this means that 98% of people think that PD Warrior is worthwhile. It is more than an exercise approach, and this is what's really important for you to know. So seek out that education, the networks, and really start thinking about how you make those long-term lifestyle and behavior changes. And then 94% of people at the end of the 10-week challenge were still exercising at 3 months. Now, again, I think this is a really crucial statistic, because if you're a person that's not exercising well now, you are predisposing yourself to cardiac problems, to metabolic problems, diabetes, to respiratory problems. All of these things are going to make the Parkinson's journey much, much harder. And they certainly don't make you immune from getting all of them. So if you're not exercising routinely now and the right kind of neuroactive exercise, you must start doing that, because if you don't, every day you don't, it is going to get harder. Your symptoms will progress faster. So I would strongly encourage you to start your exercise approach now. And hopefully in that, 10 weeks or 12 weeks or whatever you embark on, you learn the habits to keep going long term. Because, whatever we do with exercise and the education and the training, it can't be a flash in the pan. It has to be about building those lifestyle changes and that long-term behavior change. And we know that at 3 months at least, 94% of people are still exercising. And that's key to us, because we know from the literature that routinely people are much, much more sedentary at diagnosis with Parkinson's. So already you may be 30% less active than other people in the community your age that do not have Parkinson's. So we need to rally against that, and we need to help you find ways so that you can really bring enjoyable exercise into your daily lives. So the vision for PD Warrior, and certainly for you, is to change your life one rep at a time. And we do that very much by training up other health professionals. We do that by training individuals like yourself with Parkinson's, by training up family members. We deliver education, we deliver exercise, and we have a community there available for you. So please do reach out. If you don't have these already set up in your networks, already immediately available, then please reach out to us so that we can help you get started. I'll just bring that over here a wee bit. So some of the questions that I get regularly, I thought I would go through because it may answer some of the questions that you have as well. Is I already exercise regularly. Why is this different? Hopefully I've explained now why neuroactive exercise is so important to you, and having it prescribed by a professional that really understands Parkinson's is key. So this here is Jeffrey, who was running marathons 5 years after his diagnosis of Parkinson's, but it was becoming exceedingly challenging for him and he was about to throw in the towel. It wasn't until he started doing neuroactive exercise on our 10-week challenge program that he actually really started to improve, and his times, not his fitness, but his coordination, his mobility, his ability to move more freely started to really improve. And this was somebody that was really fit, already running marathons quite regularly, but he needed that Parkinson's specific approach to really take it to the next level and keep him running the marathons that he was about to give up. So if you do exercise regularly, congratulations, that's fantastic. You've already got one of the behavior traits in place. It's about now bringing in those core principles of neuroplasticity to make sure your exercise approach is neuroactive. Another question is, I want to, but I don't think I can. Reach out to us. If this is you, it could be for many reasons. It could be cognitive, it could be overwhelm, it could be mood changes, it could just be grief and dealing with the diagnosis itself, which is completely understandable. Whatever it is, we want to be able to identify that. And then we just take baby steps. You know, there's that amazing quote that says, you never eat an elephant, or how do you eat an elephant? One bite at a time. And it's the same thing here. Being diagnosed with a condition like Parkinson's, which is incredibly complex, is very, very daunting and can be extremely overwhelming. We know people feel this sense of loss of control. So helping to identify what are the biggest things that you need to do can be the first thing, the first step. And then we just take those small steps, building up towards whatever your goals and your bucket list adventures may well be. Sounds like snake oil. Hang on, I've got my chat box. Sounds great, but possibly too good to be true. It's not. There's enough literature out there. In fact, there's been an explosion of literature specifically around this neuroplastic training approach to tell us that not only is it going to help improve your symptoms, slow your symptom progression, it may also be neuroprotective. That's definitely less conclusive from the literature, but I think it's just a matter of time before we get that data set. So I would really encourage you to start moving more, see how you feel, get those quick wins in, and then start building on those. And then when you're ready, just reach out and let us help you to live that best life you can with Parkinson's. Too old, or I've had Parkinson's too long. So if you've newly been diagnosed but you're in an older category, you're never too old to start doing some of these activities. We work with people in the clinic who are 90. We've had somebody who's been 100. You know, age is not the limiting factor. It really comes from up here. If you're willing to get moving and to get started, we are the professionals and we will guide you to do that. So you are never too old to do that. And we've modified programs for so many different things. We've had people with multiple dual conditions, Parkinson's, MS, Parkinson's spinal cord injuries, long-standing back problems, whatever it might be. The program is so flexible, we can really modify it specifically to you. So age is not a risk factor. And if you've had Parkinson's for a long time and you've joined us on this presentation, again, that is not a limiting factor either. It may mean that we need to work longer and harder for smaller gains, but this approach will work and you will improve with your Parkinson's. And that may be the difference between getting in and out of bed independently, for instance. And that is very compelling for you know, one of our patients I can think of, Carol, who was much further down the track. I've got this already. I understand. I know what I'm doing. please just let me underscore again, reach out to somebody, a physio ideally, who understands Parkinson's, so they can really help to guide you and tweak what you're doing, because you don't want to risk missing a day of not doing the most in your exercise program that you can. And it may be that you need to bring in some more cognitive training. It may be that we need to bring in some speech and language, whatever it might be. You living with Parkinson's on a daily basis, even your close family, friends, they will not be able to identify issues like a health professional will, and they can really advance your program and what you're getting out of your exercise activities and really enhance the quality of life. And that's what our job is. So I appreciate if you think you've got this already, but let me tell you, I think, you know, we can really help to set you up on your program, and then you can be off doing your own thing again, DIY. So hopefully that's answered a few of those questions that you might have had, but I would be very, very happy to go ahead now and answer any other questions that you've got. So you'll see the chat box down the bottom there. I'd encourage you to pop any of your questions in there and I can start answering them for you. So I've got one question here now. Who do you recommend getting help from in the current lockdown? Is there somewhere I can get access to the PD Warrior exercises? Yes, look, we've been doing online training since about 2014. So we are really well versed in telemedicine, and specifically in this COVID era where we're open and available to see you face to face, and then we're not, and we're back to online. We've got online coaches. We've got the 10-week challenge online. I would strongly encourage you to sign up to Tribe 365, because you will get access to a lot of these exercises and tips and training options, and a community of people that are living with Parkinson's and are very like-minded and all want to be living the best that they possibly can. So if you haven't joined up to Tribe 365, that's a really good place to start. If you're ready to jump in and do something like a 10-week challenge, which is going to get you into peak physical and mental condition, then I would strongly encourage you to do that. And you can access both of those on the pdwarrior.com website. So, you know, COVID is not an excuse for not exercising. There is so much available out there now that, you know, you can access the PD Warrior program. If you're already tagged into a licensed facility, they will have options for tele-rehab as well. And if they don't, they can sign you up to the 10-week challenge. So getting started is probably the first step. So reach out and we can help you with that. And don't use COVID as an excuse, because that's just wasting time. All right, any other questions there from anybody? I hope that's been a kickstart. Obviously, I've got a very strong bias towards exercise myself, having a physiotherapy background, but I cannot encourage you enough just to take those very first steps, start moving, start thinking about what we've talked about today in terms of your type of Parkinson's. Go and do that quiz so you know, and you can get the report, and that will help you to start shaping your own exercise program at the very least. Just got one or two questions here. Where to get best practice advice on food and alcohol? I would suggest a nutritionist or a dietitian who has a background in neurological nutrition or Parkinson's specifically. So we've got a couple of connections available in Tribe 365 as well. Or you could email me. My email is here and I can help you to link in with somebody who's local to you. But it's really important that you try and understand a little bit more about your nutrition and your what you're eating and how you time that with your medication, just to get the most out of that as well. So that's a great question there. Are there speech pathologists who specifically help with speech and swallowing in Parkinson's, I'm assuming? Absolutely. And we actually have a speech pathology service who operate out of our clinic here in Sydney, who have a very, very big background in Parkinson's related issues, and they can be something as straightforward as having difficulty projecting your voice, and so it's very quiet and hard for other people to hear. It may be difficulty with language fluency and thinking of the right word at the right time. It may be having difficulty with swallowing, which can become a risk factor for pneumonias and all sorts of things. There's lots of things that they can do if they get on top of them early. So if you're experiencing problems with your articulation, your language, your projection, or your swallowing, I would strongly encourage you to reach out to a speech pathologist who has training in Parkinson's. A lot of speech pathologists will have training in the Loud program, and they'll also have training in the Speak Out Loud program as well. And you can Google either of those to try and find speech pathologists with specific Parkinson's training. Failing that, you can also email me as well. Lovely. Look, here's my email address. So if there's any questions that come to you after the webinar, don't hesitate to email me. I'm very happy to answer any questions if I can. Obviously, the advice is going to be quite general because I haven't met you. But I would strongly encourage you to start building up that support network, get your exercise started, reach out to the Tribe 365 and sign on, because there's just so much of community exercise, nutrition advice available on there as well. And I hope you have a really good day. So thank you so much for joining me.